Australia has activated an emergency plan to deal with the outbreak of the coronavirus amid expectations a global pandemic will soon be declared.
The Prime Minister Scott Morrison says the virus is spreading rapidly outside China, which has prompted his government to elevate Australia's response. Political reporter Jane Norman begins our coverage.
The global spread means it's now a matter of when, not if.
There is every indication that the world will soon enter a pandemic phase.
With outbreaks in more than 40 countries on nearly every continent, containment in Australia could be impossible.
As a result, we have agreed today and initiated the implementation of the coronavirus emergency response plan.
It's been in the works for some time and involves much closer cooperation between the Commonwealth and the states. Now the plan's been activated, it means medicines will be stockpiled, hospital wards set up as fever clinics, protective gear like masks distributed to medical staff, and so-called surge capacity built into hospitals.
How do we rearrange wards in our hospitals? Do we need to consider some ways of diverting people away from emergency departments? How does primary care play a role? What do we do in aged care facilities?
While hospitals and schools are preparing, the Border Force Commissioner has been asked to consider additional measures at Australia's airports. For now, the ban on foreigners travelling from China, the epicentre of the outbreak, will continue.
I think it is right to be very cautious about the health of Australians.
While preparations are underway for a possible pandemic, the economic impact is already being felt far and wide. The Treasury is now considering targeted stimulus packages for the education and tourism sectors hit hard by the travel ban that's been in place for the past month. For now, though, the virus is contained here in Australia. No new cases have been detected. And the message is don't panic.
You can still go to the football, you can still go to the cricket, you can do all of these things because Australia has acted quickly.
Staying ahead of an unpredictable contagion, now a game of anticipation. Jane Norman, ABC News, Canberra.
One of the big concerns about the disease spreading is a possible shortage of medical supplies.
There are fears the medications sourced in China in particular could be affected, but health officials are appealing for calm in what some have described as a climate of paranoia.
As the coronavirus spreads, so does the fear. Quarantine lockdowns in China have slowed medicine production, which authorities believe could pose problems.
It is possible that patients will be affected by shortages. There might be very specific drugs.
And with the disease on the brink of being declared a global pandemic, supply issues could get worse.
When there's a health emergency, each country will prioritise their own people, and anything that we depend on that's from another country we may not get.
There are even concerns basic supplies like masks could be at risk.
The issue, particularly at the moment, is around the supply of masks. Clearly, this is obviously of primary importance.
But the COVID-19 scare has created a nasty side effect. At the Royal Children's Hospital in Melbourne, 4 Asian Australian staff members say parents demanded to know if they'd been tested for the virus.
I expect it's also occurring in other settings in healthcare throughout Victoria, around Australia. And again, this is an opportunity to send that message that we don't accept that.
Yeah, it's horrible, right? Like, you come to work, you do the best that you can, and you shouldn't be discriminated that way.
In Australia, more than 20 people have been diagnosed with the virus, with many making full recoveries. But authorities believe the number of infections in Australia could still grow, with an expected spike in cases when flu season hits the southern hemisphere. Medical officers believe there's no need to panic, and they're well and truly prepared for the worst. Elias Cluer, ABC News.
The spread of the coronavirus has taken many by surprise. For the first time, the World Health Organization says that the new strain is spreading faster outside of China than within. The WHO has yet to label it a pandemic, but some experts, including Australian authorities, believe that's inevitable. The World Health Organization says it's deeply concerned about the spike of COVID-19 cases in Italy, South Korea and Iran. South Korean and American joint military exercises have been called off until further notice after the outbreak in Korea left soldiers from both sides infected with the virus. South Korea has reported 334 new cases, pushing the country's total tally to almost 1,600, the highest number outside of China. In Italy, where there are 447 cases, Ash Wednesday services were cancelled and retailers are struggling.
There is nobody coming in, so we are here talking to each other about coronavirus.
In the Middle East, Iraq has closed the border to Iranian nationals after Iraq's only cases were traced back to Iran. Iraqi authorities have also banned all large gatherings in public places and have closed down schools and universities across the country until next month.